Acute myocardial infarction after laboratory confirmed influenza infection. Definitions. Acute myocardial infarction can be treated by acute respiratory infections. Previous studies have suggested an association between influenza and acute myocardial infarction. But those studies use non-specific measures of influenza infection or study designs that were susceptible to bias. We evaluate the association between laboratory confirmed influenza infection and acute myocardial infarction.
Several studies have demonstrated an association between influenza infection and acute cardiovascular events. But most previous studies were limited by inaccurate methods of diagnosing influenza, and the few studies that ascertained infection by laboratory testing were underpowered and had inconsistent findings. Canadian investigators have now carried out a self-controlled case series study with laboratory-confirmed influenza to assess its association with acute myocardial infarction. Using a linked database of respiratory virus testing from 19 laboratories and a separate database of all admissions to acute care hospitals, the authors identified 332 Ontario residents who were at least 35 years of age and had been hospitalized for acute myocardial infarction within 1 year of a positive influenza laboratory test. They then compared the incidence of hospitalizations for acute myocardial infarction during the risk interval, days 1 to 7 after a positive influenza test, with that during the control interval, the 52 weeks before the positive test and the 51 weeks after the risk interval. Of 364 unique hospitalizations for acute myocardial infarction, 344 occurred during the control interval, a rate of 3.3 admissions per week, and 20 occurred during the risk period, a rate of 20 admissions per week, 6 times as high. In contrast, similar increases were not observed during days 8 to 14 and days 15 to 28 after an index influenza case. The increased incidence was robust to sensitivity adjustments, such as using multiple different risk and control intervals. The authors also found a smaller but significantly increased incidence of acute myocardial infarction admissions after positive tests for respiratory syncytial and other viruses, and after respiratory illnesses without an identified virus. The authors conclude that there is a significant association between respiratory infections, especially influenza, and acute myocardial infarction. Full trial results are available at nejm.org.
Applications in medicine. We use the self-control case series designed to evaluate the association between laboratory-confirmed influenza infection and hospitalization for acute myocardial infarction. We use various high-specificity laboratory methods to confirm influenza infection in respiratory specimens, and we ascertain a hospitalization for acute myocardial infarction from administrative data. We define the risk interval and the first 7 days after respiratory risk specimen collection and the control interval as 1 year before and 1 year after the risk interval.
There is also a new warning this morning about ties between the flu and potentially deadly health conditions. Canadian researchers say there is a significant connection between influenza and heart attacks in older adults. Christine Burak with the story this morning.
Isolated in intensive care, 65-year-old Dwight Lemaire recalls the moment everything went black.
I got up to go to the bathroom. I didn't make it. I got as far as the door. And then things started spinning and out of control.
He collapsed. His daughter called 911. With a history of heart trouble, Lemaire knew something wasn't right.
It was just a cough, and every time, I coughed, it affected my heart.
His cardiologist believes Lemaire had the flu, which caused his heart to fail. While doctors have long suspected it, a large new Canadian study published in the New England Journal of Medicine has found a significant association between lab-confirmed flu cases and heart attacks.
You're 6 times as likely to have a heart attack during the week after being diagnosed with influenza.
Generally, flu symptoms can cause inflammation in the body. All that swelling can irritate the walls of your arteries. If they're lined with plaque buildup, swelling can cause a plaque blockage, preventing blood from flowing to the brain or heart, causing a heart attack or stroke.
Some people have low risk of a heart attack and some people are higher risk for a heart attack, but anyone is basically at 6 times increased risks.
This is a big deal. I think that this really hammers home that it's time to do something.
Dr. Jacob Udell treated Lemaire. He says healthy people don't usually end up in hospital with the flu, but that a flu shot can go a long way toward protection.
If you can get something for protection, I would definitely advise it.
Lemaire says he got the shot. Even though it didn't keep him out of the hospital this time, he knows his heart needs all the help it can get.
The bottom line is it boosts my immune system, and I'm happy with that.
Christine Burak, CBC News, Toronto.
Pros and cons. Pros: vaccination against influenza or even increased them for other respiratory pathogens in patients over 75 years of age with an increased risk of ischemic heart disease, not only due to the consequence of influenza virus infection, but also to reduce the incidence of AMI.
Influenza infection is, of course, an important morbidity, and it is frequently associated with an increase in cardiovascular morbidity and, interestingly, myocardial infarction. Now in the British Medical Journal, researchers try and figure out whether or not influenza infection is a precipitant of myocardial infarction. What they found was that in patients that are hospitalized, 10% of them had some comorbidity with influenza infection when they had their myocardial infarction. An interesting issue, but after adjustment, it turned out that influenza infection was not a predictor of MI. So, what else did they find? Interestingly, it turns out that vaccination for influenza was a significant reducer of the incidence of myocardial infarction. What's the take-home message here? Well, if you're a cardiologist and you have patients with ischemic heart disease, make sure they get vaccinated. It'll protect them. And if you're a patient that has ischemic heart disease, ask your doctor to give you the flu vaccine. For CardioSource, I'm Peter Block.
Cons: AMI is produced in most cases by the instability of an atheromatous plaque and the formation of intracoronary thrombus, with the consequence of myocardial ischemia, necrosis, and possibly complications. This instability of the plaque seems to be triggered by a pro-inflammatory and pro-thrombotic state typical of acute infections such as complaint.
The news about the flu seems to keep getting worse. A new study suggests that the risk of heart attack dramatically increases for people who are suffering from influenza. A study published this week in the New England Journal of Medicine found that heart attacks are 6 times more likely 7 days after a flu diagnosis, compared to a year before or after the flu diagnosis. I was a little bit surprised by the strength of the association, chief study author Jeffrey Kwong told Reuters. It's not every day you see a 6-fold increase in the risk during the first 7 days of lab-confirmed influenza. We were also surprised the risk dropped off to nothing by day 8 and beyond. While the medical field has long suspected a connection between influenza and heart attack, it was hard to confirm the association. For the study, researchers used confirmed cases of the flu and analyzed 364 heart attacks from hospital records for Ontario residents spanning 2008 through 2015. According to the study, the heart attack rate was 20 admissions per week 7 days after a flu diagnosis, compared to only 3.3 heart attack admissions a week in the year before and after a flu diagnosis. The researchers found that the risk of heart attack increases slightly for those over 65. 69% of the 332 people in the study who had a heart attack following a flu diagnosis had not gotten a flu shot, according to the study. Kwong, a scientist at the Institute for Clinical Evaluative Sciences in Toronto, told Reuters that people should get the flu shot and wash their hands. Unlike the common cold, flu symptoms hit suddenly, within a matter of hours. Symptoms include fever, feverish chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches and tiredness. Children with the flu could also vomit and have diarrhea, according to the CDC. Flu has caused inflammation of the heart, brain or muscle tissues, and multiple organ failure. That's all. If you liked it, like, share and subscribe.
Issue apply in Ecuador. Respiratory infection by influenza virus is a trier of acute myocardial infarction, and in Ecuador it is very frequent to find these cases of infarction, probably in at-risk patients with atheromatoous plaques with significant and or vulnerable stenosis. The inflammatory reaction may destabilize the plaque, and together with a prothrombotic state of the infection, trigger AMI, myocardial infarction. Conclusion: we found a significant association between respiratory infections, especially influenza and acute myocardial infarction, confirming that these types of cases have been cured.